meeting we had yesterday with the CMDs and Medical and Dental Council, we resolved that the payment of house officers' salary should resume and continue as it were, which is in tandem with what was agreed between the Budget Office of the Federation and the Chief Medical Directors. Secondly, MDCN to accredit and capture new house officers. Thirdly, MDCN to open their portal for recruitment of new house officers and forward same to the Federal Ministry of Finance for monthly payment, just to accommodate the transition period once they assume duty monthly, as will be confirmed by the various hospitals. And then fourthly, regularization and accreditation of federal tertiary hospitals by MDCN should be concluded within the next 12 months.
So it is given 1 year to facilitate that, it's not. We all know the criteria for accreditation. Payment can be done within 24 hours. You have the manpower, because it's not only the council that accreditates. You have various trainers in all, widely spread in the country. If you want to cover Nigeria in 7 days, the council have that manpower to do it. Because we are not one doing. We have various consultants that are ready to come and go with the council, and this. So 12 months is not acceptable by this committee. Train house officers should stop. Simple. Should stop. It can never be business as usual. It's either we are ready to train house officers or we are not. State hospitals are getting accredited. So why should federal institution that is there, especially teaching hospital, that one of your core mandate is teaching, you cannot get yourself accredited? So it's not acceptable. 1 year is not acceptable. If that is the resolution, the House is not accepting that resolution.
Why was it not paid? Was the budget not extended? Number one is that the budget for personnel was not extended. Number two is that we have stopped paying salaries for non-regular. And when I said this at the Ministry of Health of Finance on the 18th of February, when we wrote on the 3rd of February, 3 days after we noticed that January salary was not paid to house officers, and that there was significant shortfall even to pay other workers for those areas. But your capital we hold until the extension time. So that our money was mistakenly mocked up, even though we had enough money in our budget. If we had the authority to pay, we would have paid that salary knowing that we had enough money.
Permit me to take this committee back to the genesis of what we have today. In 2017, the Federal Executive Council approved the centralization of posting and payment of house officers. In our computation, we took care of every graduating doctor, including estimated number of foreign trained. So a budget of 11.something billion was submitted. Unfortunately, due to logistic problems, this cannot take off.
You that your accreditation has lapsed or it will lapse. But we've been running house officers. For instance, every house officer that receive his full registration certificate, the council right back to the hospital have this house officer did his housemanship. So if my hospital have accreditation for 10, there is no way council, if they see that I have 20, they should write to me, why did I have 20?
The registrar has eloquently explained the fact that the policy as approved, has gone into the budget, and they have already received the budget of 5.something billion to start payments.
The CMDs that are yet, CMDs and MDs that are yet to submit the list of their house officers to the council are directed to do that within 48 hours. This is to ensure immediate payment of all those that are not paid by the Accountant General Office. We also agree that Council was given a period, given a period of 3 months to ensure that all hospitals that are ready to train house officers are accredited. The council is to submit mid-term report to the committee within 6 weeks, and the committee will embark on oversight on compliance of the directives after 3 months. We also agree that the committee will direct all councils to also get the list of interns under their regulations to forward it to the committee and copy budget office of the Federation to ensure each and every intern is paid as at when due, so that avoid further confusion.
Good evening, I'm Dr. Uyilawa Waisui, President and Association of Resident Doctors. I think I want to first commend the Speaker of the House of Rep, Honorable Bajamala, for his efforts in helping us to curb the threat for strike. And it's quite sad when some sectors of people want to use the House officers as chairs, as pawns, and make them suffer for over 3 months and they have not received their salaries. It's quite sad and disheartening, and I hope with this meeting we had now, there will be quick resolutions in finding a lasting solution to this problem. I actually believe in the constituents of the committee, and I hope in the next 48 hours we'll be able to resolve most of the issues. But all still lies on the Congress. The NEC members have to decide on the path and where we are going to go. But however, we'll try and guide them that we should believe in the committee, and if the resolution states that we can, otherwise we'll have to go that.
I'm Dr. Adebimpe Adebi, MNI, the Director and Head Department of Hospital Services, Federal Ministry of Health. Let me first start by expressing the profound appreciation of the Federal Ministry of Health on behalf of the Honorable Minister, Dr. Sagi Hanire, who actually had another national assignment to attend to and had mandated me to represent him at this meeting. I wish to appreciate the leadership of the National Assembly, particularly the Speaker of the House of Representatives, who mandated the House Committee on Healthcare Services to provide that platform for making lasting solutions to the problem of shortfall in salaries of essential health workers in Nigeria. Essential is the work of the House officer, but this committee actually has provided that platform for us to provide solutions to the shortfall in the salaries of other health workers, the interns in other cadres, and for the payment of house officers that have been owed from December, January, and February. We observe that this is one of those things that will be expected when you are having a transition, and an agency that has not been given this kind of mandate before, who has been preparing, and then they needed to be funded and have the buy-in of all the stakeholders. This meeting today has provided that platform for all the stakeholders to actually identify, interrogate all the problems, and jointly make resolutions on the way forward, which we have secured this evening through the resolution of the committee that within 48 hours the hospitals, the institutions should submit their lists that will be verified by the MDCN, and then for MDCN to begin to recruit house officers for hospitals that have vacancies, and then for the hospitals that do not have vacancies to also make preparations for upgrading of their accreditation status so that they can have more vacancies, more spaces for our house officers and other interns.
Honorable Dr. Yusuf Tanko Sumunu. I represent Ingas Kishanga Federal Constituency from Kebbi State, and I'm the Chairman of the House Committee on Healthcare Services. Well, we have just finished discussion. You know, we have been brainstorming for the past 3 hours. All the stakeholders, Ministry of Health, Finance, Budget Office of the Federation, the Medical and Dental Council of Nigeria, Committee of CNDs, and even the Nigerian Medical Association, Nigerian Association of Resident Doctors were all here. What we found really is not only limited to doctors, and we have tried to have a holistic approach so that no other association will come tomorrow to serve the Mr. Speaker with the petition or notice of going on strike. So we said let us carry everything holistically. The major issue was that there is a plan that had the backing of the Federal Council of Federal Executive Council in 2017 to centralize recruitment and posting of house officers under regulation of the MDCN, while the payment will be done through the IPPIS. So, you know, the transition became so difficult, and it happens that some hospitals could not pay their house officers for December, January, and February, based on which they had a NEC meeting to go on nationwide strike, and to accept Mr. Speaker. And in his usual attitude of being proactive in intervention, especially in health matters, especially when we find ourselves dealing with pandemic, he directed my committee to intervene strictly and right away. So we had a meeting. We were able to identify the bottlenecks. We have resolved them, and so far we have resolved that those hospitals that have submitted their cleared list to Budget Office of the Federation and the Office of Accountant General should be paid with immediate effect. All other CMDs and hospitals that are yet to submit their list are given 48 hours within which to do it. And also, we have also agreed that the recruitment of the house officers, the portal that is so far closed by the Medical and Dental Council, and we have a lot of them teaming around and working for where to go. The recruitment by hospital have been stopped. MDCN is not recruiting. We have given them within 2 weeks to ensure that everything is settled and the portal is open. These are among others resolutions we have so far reached.